Yes, welcome and we can proceed. Nursing consideration, you obtain a urine specimen, start a bladder training, and if incontinence is neurological, you monitor the patient for urine retention. We have the top technique of correcting incontinence with bladder training. Okay, we use bladder training. We are saying that the incontinent patient typically feels frustrated, embarrassed, and sometimes hopeless. Fortunately, we can correct this through bladder training. And this is a program that aims to establish regular voiding pattern. Okay. So before you start bladder training, you assess the patient's intake pattern, void pattern, and behavior. For example, restlessness, talkativeness before each voiding episode. You encourage the patient to use the toilet 30 minutes before the usual episode of incontinence. If this isn't successful, you need to readjust the schedule. Once the patient is able to stay dry for 2 hours, you increase the time between voidings by 30 minutes each day until the patient achieves a 3 to 4 hour voiding schedule. When your patient voids, make sure that the sequence of conditioning stimuli is always the same. Make sure that the patient has privacy while voiding, and you need to avoid any stimulant that may inhibit. Okay? Keep a record of incontinence and continence for 5 days. This may reinforce your patient's effort to remain continent. Tips for success. Remember that you have to include the patient and the family. Okay? And you need to have a positive attitude between you, the healthcare provider, and the patient for successful training. So make sure that the patient is close to the bathroom or the portable toilet. Leave light on at night and ensure a clear path to the bathroom. If your patient needs assistance getting out of the bed or chair, promptly answer the call, okay? So that you can assist to avoid unnecessary injuries. Ensure that the patient wears usual clothes. This one will indicate that they have confidence that they will remain continent. Accept alternatives to diapers, including condom catheters for the male patient and incontinence pads or panties for the female patient. Urge the patient to drink 2 to 0.5 liters of fluid each day. Remember, restricting fluid intake does not prevent incontinence, but it promotes bladder infection. Okay, so limit fluids after 5 p.m. Okay, evening, because this will help the patient remain continent during the night. Reassure the patient that episode of incontinence don't signal a failure of the program. So you keep on encouraging the patient to remain, to continue having a positive attitude. We have pediatric pointers. We are saying that causes of incontinence in children include infrequent or incomplete voiding and an ectopic urethral orifice. While in geriatric pointers, elderly patients with UTI may demonstrate only urine incontinence. Okay, only urine incontinence or changes in mental status, anorexia or malaise. So you need to be keen when you are assessing such patient. In patient teaching, we are saying that you need to be sure to include the family also or the caregiver when appropriate. You instruct the patient to perform Kegel exercises, of which you are going to do. Teach the patient self-catheterization techniques. Review drug therapy with the patient. Discuss the underlying disorder and teach the patient to reduce the fluid consumed hours before bedtime. Okay? Thank you so much.